Okay, if I could just ask you what your name is.
Malcolm Barton.
And Malcolm, whereabout do you live?
In Crowborough.
Okay. And what brought you along to Village Dental Centre in the first place?
Well, I had a loose tooth which became infected, and my face became swollen, and I realised that I had to get some dental work done.
Okay, and how long had it been since you'd last seen a dentist?
About 33 years.
Okay, so a long time. And,
Yeah.
and so how did you... Crowborough's a fair distance from here in Brighton. What brought you here in particular then?
Well, I realised I had to find somebody who was going to be pretty sympathetic, because I was quite embarrassed about the whole situation. So I went on the internet and I found your site and was quite impressed with what I saw.
Okay. And how did you feel about your teeth prior to coming here? What... the fact you hadn't been for a long time, what was in your mind?
Well, I was totally embarrassed. I knew they were in a bad state. They were getting worse, bits were falling out occasionally, but I just put up with it because I really couldn't face going to the dentist.
Okay. I mean, that's not uncommon. There's a lot of other people out there exactly the same. So you found us on the website and then you came in and you had your treatment done under what we call sedation, which is sort of sleep dentistry. How did you find that work for you?
It's unbelievable. It's difficult to explain it because I really didn't think it would be as effective as it is. Mm-hmm. It really is very, very good.
Okay, so you didn't know too much about what you had done?
I didn't know anything.
Okay, and did that helped you get through it, really?
Yeah, totally.
It makes a big difference, I guess, doesn't it? If you need a fair number of things done, to have it pretty much all done in one session or a couple of sessions, doesn't it?
Yeah. I mean, if it hadn't been done like that, I don't think I could have coped with it.
An endless stream of visits or something like that, probably.
Yeah.
A lot of the time people sort of just can manage some of it and then they sort of abandon it, really, whereas what you did was a couple of sessions and you got it done. So was it pretty straightforward for you in the end? Did you managed with that all okay? You had no troubles?
Absolutely. I mean, I was very apprehensive when I came, but I must say I was very impressed with the way I was treated, and the whole experience was okay. It was really good.
So you've got through it all. And what sort of things did you have done, just roughly? What sort of treatment did you have done?
I think there was about 14 fillings, 2 extractions, some crowns.
Okay. So quite a variety of dentistry, not just the little bits and pieces.
Yeah.
And you've managed okay with all of that and everything feels okay now?
Yeah, absolutely perfect.
And how do you feel about things now that you've had it done, that you've broken that sort of impasse, really?
I'm quite pleased with myself, and
I should think you are.
And everybody who's seen my teeth are quite impressed because I think they knew that they weren't very good.
Yeah, okay. And I should think you feel quite proud of the fact that you've got past that obstacle, really. It's been a bit of a barrier in your way. And so would you have any problem about recommending anybody else who felt the same as you've been putting it off for years and so on?
No, I'd recommend you 100%.
Okay.
Absolutely.
Thanks very much, Malcolm. Appreciate that.
Thank you.
That's great. I mean, that does help because, you can imagine somebody else will look at that and think, I can do it as well. So, yeah, good. Okay, that's pretty well all we needed to do. So that's the easiest visit you've ever had to the dentist, isn't it?
It is, yes.
Okay, good. Well done. No, I mean, it does make a big difference because when patients have sort of been, putting it off for years, then they come and have something done, you do feel a certain level of, I've managed to get around that, really. So, no.
So what happens now? Do I sort of come back in a year or something?
We'll send you a recall in 6 months.
Right.
Have a look, just make sure you're okay, so it won't be any big deal then.
Lovely.
And I think we're seeing your daughter then.
She's downstairs.
Right, okay, good. We'll see you in a minute. Okay, thanks, Malcolm.